So one of the top questions we get on a regular basis with our patients is, how do I work out with shoulder pain? How do I work out around shoulder pain? How do I work out safely coming out of shoulder surgery? So I wanted to create this video to help with our patients to do what, really what we're trying to achieve in almost every situation is give people back a very healthy, active lifestyle where they don't have shoulder pain. But very often we have to work ourselves back into that or work around a shoulder that isn't working great. And just to give you a little background on myself, I am an orthopedic surgeon. I specialize in shoulder surgery. That's all I do. But I also was formerly a football player and played football in college and was a very, very passionate weightlifter. And that's actually how I injured my shoulder 25 years ago, was working out bench pressing. And I was an obsessive lifter. And so I have 25 years of experience of working out around a shoulder that hasn't been perfect and has had a couple of surgeries, but have been able to get myself back to a pretty high fitness level despite the issues I've had with my own shoulder. And then I also have over 10 years of experience of being a shoulder specialist, working with thousands of patients coming out of surgery and also just dealing with shoulder pain. So let's just start with some fundamental principles. When you're working out with shoulder pain or an injured shoulder, don't do things that hurt. And by hurt, I mean on a scale of 1 to 10, don't go above a 2. All right. So if you continue to do things that are very painful, that's your body's way of saying, like, that's too much stress. I'm not ready for that, so don't do it. Another thing is sometimes when you're doing the workouts, you don't feel as much discomfort, but the night after or the day after, you'll feel this intense soreness, aching, sharp pain in your shoulder. And that's kind of the rebound after you lose the endorphins from working out. So it's not just, is it painful while I'm working out? Is it, do I pay a price the next day or the day after that or that next night? So just pay attention to those things. If you need to go, change the arc of motion, change the position, all those things, whatever you got to do. But we'll go through some tips in this video on like real things that you can put into your workouts so you can exercise your muscles without straining your joints, especially the shoulder joint. One fundamental thing that I tell people is, the farther your hand gets away from your body, the more stress it puts across your shoulder because it's like a lever arm, right? So the tighter I get in, if I can see my hand, it's closer to my body. If my hand gets farther away, I can't see it, that's more stress. So try to keep things where you can see your hands in general. Even with a bad shoulder, you can do biceps, you can do triceps. A low controlled row on a rowing machine is typically very well tolerated. And then I'll go through some more exercises that we can do right now that are real exercises you can start with. So one exercise I love to start with is the TRX. I use this on a regular basis. This is awesome for upper body work because with the TRX machine, you can totally control the resistance by how close you go or how far you are. And it's limitless. I mean, you can make it really, really difficult or extremely easy. And so one thing that I start off with all my workouts is just a high Y, this position, right? Now, your shoulder may or may not be able to handle this, but if it can, this is a great way to start. And if you want to move even closer, you can make it so it's very, very low resistance, but you want your hands up high like this, and it's a beautiful exercise to get your scapula, to get your posterior rotator cuff, right? So that's one thing to start with in the TRX. And then if you want to start doing some pressing motions, this is a great way to work yourself into pressing because your shoulder blade is free. So if you watch my shoulder blade slide back and then gliding forward as I press. And you can make this very, very difficult by standing closer or very, very easy by coming this way. Okay? You can also throw in some tricep extensions. You can come around this way. You can do low rows. And another tip is when you're exercising with shoulder pain, slow everything down. Try to do a 3 to 5 second eccentric and a 3 to 5 second concentric. Other things are, don't feel the need to stretch deep like this. Now, if you can, great, but if you're in a lot of pain, work through the mid arc. So you don't need to pull all the way this way. Okay, that's very stressful on your shoulder joint. You also don't need to go all the way out like this. If you tend to work in this mid-range, right here like this, you're still stressing all the muscles. Okay, you're still stressing your lats, you're still stressing everything, but you're not stressing the joint when you don't get that in arc of motion. I think a lot of people, when you come up working out, it's always stressed, oh, you have to hit full range of motion. Yes, that's great if you're not dealing with an injury, but when you're dealing with an injury, you got to take what your body gives you, and often, a full arc of motion is not going to be that. So the next thing I want to talk about is push-ups, planks. If you can do push-ups, great. Something to start off with is a plank, right? And so a plank is just an isometric hold in this position right here. And if you can do this for 5 to 10 minutes, you're still stressing your body great. If you can't do that, then just start off with planks on your knees, okay? If you can't do full push-ups, then you start doing push-ups on your knees, and then you slowly build yourself back up. Another thing about push-ups that I've learned is to be very, very cognizant of letting your shoulder blade, your shoulder blades retract, okay? And then widen as you come out. So there's protraction of your shoulder blade, which is your shoulder blades flipping out, and then there's retraction of your shoulder blades. So when you're in a push-up, wow, look at my back here. When you're coming down, you want to maximally retract your shoulder blades, and then when you're coming up, you want to protract your shoulder blades. And what that does is, if you think about the ball and socket of your shoulder, as your shoulder blade moves, as you press, it minimizes the shear force. That's why bench pressing, where you're pinned in, is really, really hard on your shoulder because your shoulder blade is locked. Now, you can undo that and we can show you, we're gonna do a video how you can kind of let your shoulder blade like a protracted bench and then let it come back. Now, you can't move as much weight, but the goal when you're having an injury is not to try to move more weights, it's to try to stress the muscles. So with push-ups, really focus on retraction and protraction of your shoulders. Other things you can do are just an isometric hold with one arm, a slight bend in the elbow, and then bring your other hand to your side. This puts a ton of stress across your triceps. This way right here too. So those are a great way to do push-ups. The TRX is an awesome way to work yourself back in very, very slowly. Again, be very, very careful about the tempo, slow tempo. You don't need to go deep in either direction, and just listen to your body. Okay, so we're gonna come over here and do some lifting stuff. Any type of machine like this is going to be your friend when you are dealing with a shoulder injury. Again, I said, biceps and triceps are typically very well tolerated, and also you can work your legs too. So don't forget you can work your legs. But any machine where you're just going to be locked in here in just a nice low row, hold the position, and then slow down back. Your hands are very, very low and they're close to your body. So now, again, watch the weights. Try to think about using weights to strain your muscles versus, or using weights as a tool to create stress on your muscles versus I'm using my muscles to move heavy weights. You have to kind of change your mindset and your thinking. So low row is a great exercise, but we'll come into some of the pressing stuff. This right here, the bench press, okay, is obviously everybody's obsessed with their bench press. When you start lifting weights, it's a big, big ego driver. I'll be honest, there's two exercises that are the most stressful on the human shoulder that you see in the gym. A flat barbell bench press, number one. Number two would be a fly, like a dumbbell fly. If you have zero problems with your shoulder, then go ahead and do them. But if you're dealing with shoulder pain, I would remove the barbells from your repertoire of working out, right? Because barbells lock you in, they remove any of the freedom of your joints, and so they basically make it so it's really, really stressful on the shoulder. So I like dumbbells over barbells, and what I like most out of everything is just machines. I know some people feel like you're never going to be as strong or as big or as athletic if you're using machines. That's completely false. The body just responds to resistance, right? So you just need to think like all I need to do is stress these muscles. But I've got many patients who have extremely arthritic shoulders who are in their 50s, 60s, 70s who have avoided surgery or put off surgery for an amazingly long time, who are still able to lift and maintain very muscular physiques, but almost all of them have switched to machine work. So think more hammer strength machines, think more hammer strength this way. If you're doing dumbbell work, be very, very slow and controlled. Don't go super deep. And again, focus on when you're pressing with dumbbells, a retraction or a protraction of the shoulder blade on a press up and a retraction on the way down. That's why I like push-ups. I like the free presses those way. And I'll show you a way to do a dumbbell press in a very, very easy way on your shoulder over here.
Stop touching my balls.
So standard dumbbell press, you would take two dumbbells and you just be here like this. Now again, it's easier on your shoulder the more you get your elbows kind of in this plane because it's the plane of the scapula. The easier on your shoulders if you don't go super deep here and if you don't lock out. Now, if you can do those things without pain, great. But if we're painful, that's kind of the progression: is a shorter arc, a slower movement, and more elbows in this way than versus this way, right? One way that I found a great way to press is just having your hand on your hip and everything's freed up, okay? And you're just gonna go here, right? Here, like this, right? It's a full body press. But what it does is it unlocks your shoulder blade so that you can really, really glide maximally as you press the weight underneath you. So it's a wonderful way to press a weight without having any shear stress on your shoulder. And I'll show you with a press what I'm talking about, like an incline dumbbell press. So you're here, when you have painful shoulders, try not to go upper arm parallel to the floor, and I'm retracting my shoulder blades, and I'm pressing here like this. So I'm retracting, and I'm pressing up like this. I'm retracting, and I'm pressing here, okay? And I'm watching my depth. I'm not going too deep, and I'm pressing in this plane right there like that. So again, if I had to kind of just give a summary of everything, it's, ways to minimize stress are slow things down, lighter weights, higher reps, shorter arc of motion. The closer your forearm and your elbows are to your body, the less stress on your shoulder. The more you allow your shoulder blade to glide on your body, the less stress across your shoulder joint. Because if you pin that shoulder blade down and then you're moving your shoulder just to the joint, the scapula-thoracic motion is 60% of the arc of the motion of the shoulder. So if you pin it in, you're really, really, in an unnatural way, causing a massive amount of shear stress across the glenohumeral joint. And these principles apply to if you have arthritis, if you have instability, if you have rotator cuff tears, if you have rotator cuff tendonitis, basically all forms of shoulder pain. So again, I think it's super important that you get into the gym and work out. I think we tell everyone we want you working out immediately after surgery. I never want people to stop exercising, but it does require some modifications along the way when your shoulder is not in tip-top shape. But don't throw the baby out with the bathwater. Get in the gym, do as much as you can without causing more pain, more damage, and everybody that works out and exercises, they feel better, they heal better, right? They feel better, they heal better. So sitting around doing nothing is never a good option. So these are some things that I've learned over the years to try to get you in the gym so you can still exercise and even exercise your shoulder in ways that don't cause nearly as much pain till we can get you to wherever you want to be so that you're not having to deal with it on a regular basis.